We see a lot of recommendations in modern medicine. I go through them in the book Blind Spots, where a scientific discussion takes on a herd mentality and then a mob mentality, where all of a sudden questions are forbidden. And what happens is the medical experts will often lock arms and walk off a cliff together and cause tremendous damage.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. Thank you so much for joining me. Now let's get started with this week's episode. Hello, and welcome back to the Pursuing Health podcast. I am very excited to be here today with Dr. Marty Makary, who is a New York Times bestselling author. He's a healthcare expert at Johns Hopkins University. He writes for the Wall Street Journal, and he served in leadership at the World Health Organization. He received the 2020 Business Book of the Year award for his book, The Price We Pay, which has been described by Steve Forbes as a must-read for every American. And his newest book, Blind Spots, which is also a New York Times bestseller, explores the latest scientific research on major health topics today, where medical dogma has loomed large. He's a public health researcher. He leads efforts to improve the health of communities and focus on the redesign of healthcare to make healthcare more reliable, holistic, and coordinated, especially for our most vulnerable populations. He leads national efforts to increase medical transparency and lower healthcare costs for everyday businesses and consumers. And clinically, he's the chief of Islet Transplant Surgery at Johns Hopkins and is the recipient of the Nobility in Science Award from the National Pancreas Foundation. He's a visiting professor at over 25 medical schools. He's published over 250 peer-reviewed scientific articles. He's also been elected to the very prestigious National Academy of Medicine. He's a graduate of Bucknell, Thomas Jefferson, and Harvard, and completed his surgical residency at Georgetown and his specialty training at Johns Hopkins Hospital. So quite a bio and very wide-ranging and diverse, and I am so excited to have you here on the podcast for this conversation. So thanks for joining me.
Oh, great to be with you, Julie. Thanks so much for having me.
Yes, and I am excited to dive into some of your latest research and writings, especially your book, Blind Spots, but would love to know first just how you moved from this career in a very subspecialized, prestigious surgical specialty as the chair at this very prestigious institution to then focus on public health and focusing on these more broad topics and uncovering some of the areas where medicine has got it wrong. How did you come to develop that interest?
Well, it started in medical school. In medical school, I felt very disillusioned with modern Western medicine. We were not talking about a lot of the big topics that appear to be very central to health. We never talked about food or nutrition or exercise. We never talked about the microbiome or gut health. And there were these giant blind spots that I felt like we needed to address and we were not addressing. So I quit medical school after 3 years. And I enrolled in graduate school for public health. And I loved it. I felt like finally I had arrived. These were my people.
Wow.
And we were talking about the big topics and the big questions.
Yes.
You know, in medical school, it is very dismissive of big questions. So, for example, you learn that infertility rates are skyrocketing, that the age of puberty is going down every year, that sperm counts have gone down 50% in the last half century. And if you ask why, the questions are dismissed so quickly. And it's like, no, wait a minute. Why are we? This is like an existential threat.
Right.
And so I've often been interested in the big questions. And I think modern medicine today needs people to ask big questions and challenge deeply held assumptions.
That is so true. And you're so right. I can relate a lot to that. And it takes a lot of courage, I think, for someone to be 3 years into medical school and say, hey, this isn't what I really wanted or expected. Let me change course, because I know so many of my colleagues that once they even get a couple years into medical school, they say, "Well, I'm this far in. I'm not. I can't.
Like a
I
trap.
can't change." Right. So that's amazing. So then you did your MPH, and then you actually decided to come full circle and finish med school and do a residency as well.
Yeah, I missed the bedside care. My dad was a doc, and I saw how much his patients just loved him over the many years he would treat them. So I did miss the bedside care, came back to medical school. I chose surgery as a specialty. I kind of thought I would be a missionary doctor, and someone told me if you want to kind of do everything overseas, then surgery is a good specialty because you can read the other stuff, but you need to learn the skills. So I did that, and then just one door opened up after another, and I ended up where I am here today.
It's amazing. That's amazing. I always love hearing different people's path and how they got there. Well, let's just dive in. You give so many fascinating examples in your book, Blind Spots, about things that we have gotten wrong in medicine. And so maybe we can just dive in with a couple of those examples. I thought one of the most interesting and the ones that I think a lot of people will understand and relate to is peanut allergies, and how our recommendations have changed on that. Can you explain more?
Yeah, so probably the most important thing in medicine is humility and to just say, I don't know, and that's the right answer. And if you look at the actions of the medical establishment, I'm not talking about rank and file health professionals, but the oligarchs at the top, the priesthood, if you will, a small group of doctors who are making broad edicts and deciding what is and is not worthy of being in the center conversation in American medicine. They have done some tremendous damage. Take, for example, the modern day peanut allergy epidemic. It doesn't exist in Africa, many parts of the world. This is a uniquely American problem. Also in the UK, where they mirrored what we did in the United States. In the year 2000, the American Academy of Pediatrics told parents to ensure that their kids avoid peanut butter and peanut products until they turn 3 years of age. Now, they thought that avoiding peanut products in the first couple of years of life would reduce the risk of peanut allergies later in life, but they got it perfectly backwards. They forgot about immune tolerance, or the basic principle of the dirt theory. And so, for most of the last 25 years, it was medical dogma with no scientific support, urging mothers to make sure they did not have any peanut products themselves when they were lactating or pregnant, and to make sure their kids had total peanut abstinence until they turned 3. That was very damaging, and it ignited the modern day peanut allergy epidemic. And the more kids who develop peanut allergies, the more the vicious cycle perpetuated, because then there was then an abstinence of peanut butter in the home and peanut products in the home. And schools had to then start banning peanut products. Many of these allergies are real, so people should not mock them. But this is by and large a crisis that was ignited in the year 2000 with this dogma. And it wasn't until 9 years ago that the definitive study was published proving them wrong. And until then, they just echoed the same dogma. The National Academy of Allergy and Infectious Diseases, many of the societies, it was the right answer on board exams for pediatricians. It was a giant blind spot, and it really was a function of a lack of humility. They should have done the study before issuing the recommendation, because the most dangerous thing you can do in medicine is to make a broad recommendation with such absolutism as if it's scientifically based when it's not. It's just a gut feeling.
It's so crazy, and something that also it doesn't even necessarily make sense mechanistically if you think about, like you said, immune tolerance. And so to think that a hypothesis like that could then be presented as fact and change our entire country's, health and peanut allergies, and the way that then impacts schools and the extra effort it takes for school systems to be able to work around this, and all the additional suffering for kids who have these allergies. It's wild.
It's wild. I went back for the book and interviewed some of the doctors who made the initial recommendation and basically asked them, what were you thinking? There was no scientific support. This was put out with such absolutism. And they thought, Well, the public was asking us what to do to prevent peanut allergies, and we didn't know, so we just thought we needed to tell them something. And I said, "No, you don't. You don't have to make something up if you don't know. You can say we don't know."
Right. I think the best measure of a good doctor, right, is being willing to say when you don't know. And patients, respect that. They would rather hear that than hearing something that's actually not true.
Yeah, people are hungry for honesty, especially now. Public
Yeah.
trust in doctors and hospitals has plummeted in the last 4 years. A study just came out in our journal JAMA. Trust in doctors and hospitals went from 71% 4 years ago, now down to 40%.
Wow.
That's a 31-point drop. So people are hungry, in my opinion, for honesty.
It's very true. It's very true. How do you think, like, why do you think we're in this position where humility is so often undervalued in medicine? And how do we help to change that? How do we help to just facilitate more humility in our medical training and in our system?
Well, first of all, we have to change the culture of medicine. I try to model to the best of my ability humility to my students and residents. When I operate next to a surgeon who's a senior partner next to mine who's very famous, him and I will ask each other questions in front of our students, even though I know what the answer is going to be, but I want to try to model this behavior in front of them. So there's no textbook, right, for humility, but we should model this. We need to change our medical culture. Right now, it's a memorize and regurgitate culture. We don't teach non technical skills like effective listening skills and teamwork and communication and knowing your limits. Medical education is completely devoid of any meaningful nutrition education. So we don't talk about root causes. I think that is something we have to focus on, but it's really changing our culture, in my opinion.
Yeah, I think that's so true. It's something I think I didn't learn. I didn't begin to open my eyes to until after I had graduated and was out practicing. And as a part of caring for family members, I had my significant other had been through a lot of healthcare challenges with his parents, and his approach was, now it makes so much sense, but it's so opposite of how the medical system works, where he would say, let's ask all the experts on this condition and get them to talk to each other so that we can get to the best answer. But in healthcare, oftentimes when you propose, the best doctors that we found were the ones who were willing to talk and willing to incorporate other ideas and be curious about it. But so often I think people get defensive because they think that they know everything, they have the degree, they're wearing the white coat. And so, it's somehow a threat when you try to ask questions or bring in other ideas.
I'm sorry to laugh, but I just hear this so often,
It's so
right?
common.
It's like, who's in charge?
Right.
We have this system where we're so busy billing and coding and seeing patients in short visits. I think
Yeah.
we've done a terrible thing to doctors. We've told them, focus on billing and coding, and we're going to measure you by your throughput. And we haven't
Right.
given the doctors the time or the
Oh,
knowledge or the resources to address the root causes. And
absolutely.
if we stop for a second and stop all the busyness of healthcare, this is the largest business in America. If we stop for a minute and look up and look around us, all of the chronic diseases we're treating are going up massively. Autoimmune diseases, early onset Alzheimer's, diabetes, obesity, infertility, PCOS. And it's like, hey, can we stop this busy insanity of just playing whack a mole
Yes,
and
exactly.
actually deal with the root
The
causes?
root causes. Absolutely. Yeah, it's it's pretty wild. On that topic, looking for root causes, you also talk in the book a lot about the microbiome and how much research is out there linking the microbiome to so many of these conditions and how important nutrition is, yet we don't get much education on nutrition in med school. So I'd love to talk a little bit about that and some of the interesting studies you found that really start to ask questions about root causes and microbiome and how we might start to address those.
So there was a study that I saw that really blew me away, Julie. And, um, you may have seen this in the book, and I'm curious what your reaction was. But my reaction when I saw this study was, I cannot believe we are not talking about this study nonstop in modern medicine. Hardly anyone noticed the study. The Mayo Clinic conducted it along with a former chair of medicine at NYU, who's kind of the world expert on the microbiome, or at least I think our US expert. And it showed that kids who take an antibiotic in the first couple of years of life compared to kids who don't. Now, remember, antibiotics carpet bomb and alter the microbiome. Kids who took an antibiotic in the first few years of life when that microbiome is forming had a 20% higher rate of obesity, 32% higher rate of attention deficit disorder, higher rates of learning disabilities, a 90% higher rate of asthma, and nearly a 300% higher rate of celiac. All conditions we have seen massively
Huge
explode in the
increase.
modern era.
Yeah.
And it's like, God, and the more doses, the more courses of antibiotics a child took, the greater the incidence or the risk of each of those chronic diseases. And it's like we scratch our heads as to why celiac is common. We scratch our heads as to why people are obese or why some adults can eat perfectly well and exercise and not be able to lose weight efficiently. And here is a study telling us, hey guys, it's the microbiome. I mean, if this is ever a signal in the data, this is one we have to listen to.
Right. We should be pursuing it in a big way. Yeah, it's pretty crazy. And I think interesting that, I see in patients, there's a lot of fear around antibiotics because they hear this, they know this. And so, they want to avoid antibiotics at all costs, which I think is good because they're so widely overused. But it also brings up an interesting question because we know that antibiotics have helped increase life expectancy pretty significantly, but there's probably a very select group of people where they are helpful if we could identify those people that really need them to have that improvement in life expectancy, but then avoid the overuse, avoid the people that don't need them. And I'm just curious about how that might play out as we start to understand more, when these are really needed. And how we might have done things differently when we first, came about, discovering and using antibiotics.
So you're raising a really good point, Julie, and that is everything is nuanced. So if people react to what they hear by simply saying, hey, antibiotics are doing all this harm, so we have to avoid them, you will also do tremendous harm to children, to yourself. And antibiotics save lives. I've seen cases where an individual doesn't want to treat a kid's ear infection with antibiotics. Kid develops some hearing loss, and then they diagnose them with a learning disability when the truth is they just can't hear because of that untreated ear infection. So everything is nuanced. So antibiotics are important. It's really probably the miracle of modern medicine. But 60% of those that are prescribed over the outpatient are unnecessary. And people need to understand the dogma that, they probably won't help you, but they won't hurt you, so just take it anyway. That can do tremendous damage. And it's not just antibiotics that really alter the microbiome, it's C-section deliveries. Again, C-sections save lives, but they're also overused. We have overuse and underuse. Both problems exist in medicine, but by far, overuse dominates our fee-for-service system. Ultra-processed foods, seed oils, microplastics, heavy metals. What are pesticides on our food doing to the microbiome?
Yeah.
If pesticides kill insects, what do you think they're doing to millions of different bacteria in our
Right.
microbiome,
Just common
right?
sense, right?
Yeah, I mean, they just did an analysis of a school lunch in the Washington, D.C. area. 38 different pesticides were detected in the lunch.
Wow.
These pesticides and chemicals are showing up in the urine of children. They're showing up in the cord blood of newborn babies. So people need to detoxify their lives. And so that's why I wrote this book. That's why Casey Means is out there. That's why
Yeah.
you're doing your podcast, Julie. We're trying to educate people so they can make better decisions.
Mm-hmm. Yes, it's so needed. And it's one of those things where I think, it's so difficult for people and surprising to people because you think there are certain things that you think you'll be protected from. Like, okay, the food I buy in the grocery store should be, at least free of chemicals, or there's some level of protection that should be provided, but it's not the case. And so often people are really having to take this into their own hands and do their own research, and it's a lot of work. And the more you discover, the more you realize that most of what we're eating is not great for us. I think you mentioned celiac disease earlier. I think one of the most interesting, just anecdotal examples I see in my patients all the time are patients who have celiac or significant gluten sensitivity with symptoms when they eat gluten, and then they go over to Europe and have zero issues. I have a patient who had tons of symptoms on gluten here. She went over to Europe, was eating spaghetti, was eating all the great things that they have in Italy, had zero issues, and came back and was getting sick again. So there is so much more than just the food, right? It's how the food is processed, it's the
Yes.
pesticides, it's the way that it's genetically modified. There's so many different factors that are different that really need to be studied and understood before we're just widely giving them to people, right?
It's amazing. It's the grain, it's the genetic modification of the grain. When Agent Orange was developed and they sort of realized, hey, if you put mega doses of chemicals on crops, you can kill all the insects. But they noticed they were also killing the crop. So then they thought, let's genetically modify the crop to be Roundup ready, to be
Right.
resilient. And that's our food supply in the United States. But the thing is, humans are not Roundup ready,
Right.
right?
Right.
So
We've not genetically modified ourselves.
I every time we have Italian food, we buy it from a place called the Italian Store that has their
Uh-huh.
pasta and
Yes.
all their food directly imported from Italy. And
That's the way to
what
go.
you're saying just resonates. Like that, I've had a patient. We order the kitchen sink of tests for chronic abdominal pain. No one
Yeah.
knows what's going on, and we do things, and no one can. They get bopped around to specialists, and it's frustrating. And then they come back and say, I spent the summer in Europe, and all my pain went
In a
away.
way. Mhm. Right. It's crazy, and it is when you think about even healthcare resources, it's a lot of suffering for patients that don't get clear answers, and there's no clear, diagnosis, and they feel lost, and there's also a lot of waste in the healthcare system from that, from chasing these things that could be prevented by addressing the root causes.
Yes, yes.
So another area, just kind of moving forward from the C-section point that you just made, is there have been a lot of interventions in obstetric care that have changed, that have been very helpful. So things like delayed cord cutting and skin to skin time and early breastfeeding. And I'd love to hear more about this. Like, first, these are examples of things that were implemented in our system without, right, probably without great data or research, and then have been changed, and we're seeing improved outcomes. But I'm also so fascinated just by the timeline of how long it takes for the research to be done and then these things to actually be widely implemented throughout our system.
So I go through a lot of the best practices of childbirth today as we know them with the best available science in the book Blind Spots. But if you take a step back, we're sort of rediscovering some natural principles. And modern medicine feels like, oh, look, we just discovered that if we don't cut the cord immediately,
Right.
you know, that it's like, yeah, there was something in medical school it just felt wrong that here's a cord pulsating immediately upon birth. You're still watching all this fluid, which is stem cells, healthy fetal hemoglobin, nutrients, warm fluid to keep the baby warm, directly infused in their circulation, as opposed to like cutting the cord and whisking the baby off under some French fry light to rewarm the baby.
Right.
And so, if you take a step back, for most of human history, doctors were respected, but not held up on this very high pedestal. They were respected like other professions, maybe a clergy member or uh, a barber. And so, in matter of fact, in the UK, barbers and surgeons, it was the same profession. They called them surgeon barbers.
Wow.
I mean, you had we didn't have a lot of tools in medicine then. You had a
Right.
saw,
Right.
a lancet to make people bleed out, take out the bad humors. I mean, even George Washington, they did that too. And and then there was a couple ineffective medications like digoxin, and that was it. And so doctors were respected, but not held up on this high pedestal. And then the discovery of penicillin happened. For the first time ever, we could prescribe a magical pill that could instantly cure you. It enabled us to do operations. It made childbirth safer. And after World War II, when the mass production of antibiotics initiated, doctors began to wear a white coat, ushering in what we call the white coat era of medicine. We began detaining babies immediately upon birth. We would took advantage of this authority, this unquestioned authority. People would stay in the hospital for prolonged periods of time. Every baby that was born was immediately separated from their mother and put in a nursery for 10 days on average.
It's crazy. Yeah.
And we would poke and prod, and we had our logic. And then industry moved in and told us that baby formula was healthier or just as healthy as breast milk. And this pendulum has really swung, where we had this sort of unquestioned authority and took advantage of it. And now it's swinging back the other way, where there's some increased distrust. And the reality is, you and I, as physicians, know that medicine can be amazing, but it has to be applied appropriately. And people need to be given all of their options, including alternative options.
Right. And to know, there's no recommendation with 100% certainty. I
That's
think
right.
so often things are presented as very obvious and you never know how each person's going to respond. Yeah. Yeah. It was so interesting to me with even the, or just what you were just saying about, how medicine used to be when doctors didn't have as many tools. It reminds me, I don't know if you were exposed to this painting, but it seemed to come up in every humanities class that I had in college and med school, this painting called The Doctor by Sir Luke Fields. And it's this image of a doctor just sitting next to a child who is dying from an infection and has no tools, could not do anything. And it's just him sitting there, the parents in the background really distraught. And at that time, it was always brought up as a point to illustrate the humanity of medicine and like the value of just being with your patients through things that are sometimes very difficult. And I think sometimes, or at least now, I think that because there are so many tools and because there has been this shift of like, oh, we have all the answers and we have this specialized knowledge and, we're always right, that sometimes that, and like you said, the system with based on throughput and volume and the busyness, there's not a lot of time to just like sit and really think critically about a case or to just be with your patients. And I think we've gotten away from some of that. And that's part of why there is so much distrust is it often doesn't feel like in a busy, 8-minute office visit with a doctor on the EMR the whole time because they're just trying to get through their day so they can spend time with their family at night and not do notes. That there isn't that same kind of human connection, and that really facilitates a lot of this distrust.
Yeah. Yeah, gosh, I love that painting. And so many of the great works of American history and medicine really depict this transformation, to the point where now you have telemedicine visits where you can't even look into the ear for an ear infection and antibiotics are getting prescribed. And people are on demand insisting on Ozempic and GLP-1 drugs without any real discussion about the root causes. And if anything, they've been raised on misinformation sponsored by the United States government, which has been ironically one of the greatest propagators of misinformation, demonizing natural saturated fats, ignoring the role of ultra processed foods and refined carbohydrates, ignoring the role of chemicals. Um, you've got companies like Kellogg's making two versions of their
Yes.
cereal, right? One for Canada, where it doesn't have all, many of these chemicals, including the food dyes and BHC, uh, which have been implicated in hormone disruption and genetic changes and attention deficit disorder. And in one country, heck, you get fined $450,000 if you have BHC in a food that you sell. And so they're
Crazy.
banned in most parts of Europe and Canada. So Kellogg's makes one version of Fruit Loops for them, and then another version that's more colorful with more chemicals and food dyes and BHC in the United States. And so it begs the question, don't American children deserve the healthier version of a food made by an American company?
Right.
And so for the first time, we're seeing now education where people can learn about this. Vani Hari is doing a great job as a
Yeah.
mother activist on this topic, but
Yeah.
people are now finally starting to look into our own blind spots in modern medicine.
Yeah, it's beautiful to watch. Just I watched part of that demonstration at Kellogg's last week, and it was very moving just to see people, passionate and wanting to do what's right for their children, and being vocal about it and coming together and protesting in a peaceful way. So, um, yeah, the just talking about the even the role of the government and some of this distrust. I love that you're willing to speak out on this because I imagine it's not always well received, and I'm curious about how some of the things you've put out there have been received even by your colleagues or other people at your institution. But specifically around, I think COVID was a great example. You wrote this article called "Why America Doesn't Trust the CDC," and you gave some examples. And I think through the COVID pandemic, there were a lot of highs and lows of people really relying on, the government's recommendations, and then also a lot of distrust. Can you share more on that topic and what you think are some of the ways that, we did a good job at what are some of the ways that maybe we've gotten wrong through the pandemic?
Well, I think the biggest mistake during COVID was the failure to recognize the 10,000 fold risk difference between an older individual with a comorbidity versus a young, healthy child. And so you had these blanket policies. Many times the kids had the harshest restrictions. You look at children, I guess teenagers here at my own university, forced to wear cloth masks. Heck, no one even knows if a cloth mask is effective at all. Studies have suggested cloth masks are ineffective. So they were forced to cover their faces for essentially 3 years, shut out of schools. Young children here in inner city Baltimore were shut out of their schools for nearly 2 years. And we were told, oh, don't worry, it'll be fine. There won't be any downsides to covering the face of a toddler for 3 years. And guess what? They were very wrong. I spoke up till I was blue in the face about the importance of reopening schools in the fall of 2020. Um, but there was a single narrative, and we were basically told we're all trying to stay on message so as not to confuse the public. Well, in my book, Blind Spots, I go through several examples where modern medicine has done that, sort of silenced or censored doctors with dissenting opinions, experts, reasonable experts from good institutions with
Right.
dissenting opinions saying, hey, no, it's not natural fat that's bad for you. It's sugar. It's the added sugar and refined carbohydrates. And it's the same story. So we got a peek into how the medical establishment operates during COVID. Um, there's a film that I sat for to be interviewed called Thank You, Dr. Fauci. And I think it comes out next week or
Okay.
next couple of weeks. I don't know how the film is going to turn out, but they did basically the deepest dive anyone has ever done on the
Wow.
COVID origins
Okay.
and talked to everybody. And I was pretty impressed. I don't think Dr. Fauci is going to be sending me a Christmas card this year. But it's good to have different opinions. I think
Yes.
if we're civil and respectable and we don't have any low blows, it's good to um, for us to do studies on natural immunity, which I did at Johns Hopkins. We asked the NIH to do those studies to recognize natural immunity, to look at the data, to test the blood of people who are infected with COVID in New York years prior and ask, are those antibodies still present? Are they effective? So when the government did not do certain studies, I took it on myself with colleagues here at Johns Hopkins, and we did some of the studies, including the largest study of natural immunity, longitudinal with blood test results, and published it in our number one medical journal, JAMA. The study was the second or third most read study in all of JAMA that year, according to their own website. But it was censored from social media. Here was
Wow.
a study done with good methodology in our top journal, but it was a message they did not want to put out there. And when I asked public health officials privately, why are you putting your head in the sand as teachers and firefighters and military personnel are getting fired for not having the COVID vaccine when they recently recovered from COVID and
Right.
have antibodies? They said, well, Marty, look, you're right about natural immunity. It's effective. We know it's a real thing. But we just feel like we need to have one streamlined message for the public, and that message should be simple and easy for everyone to understand at the same level. And I told him, I said, you're making a tremendous mistake because you can be honest about natural immunity and encourage vaccination of high risk individuals, both. And by not being honest, it'll eventually come out. People are smart. They already know natural immunity has been a thing since the Athenian plague of 430 BC. I didn't invent it. And you will create a tremendous amount of distrust. And that's where we are today.
Yeah, and it has downsides because when there's that distrust, then the people who really could benefit from vaccines are also a lot of them aren't getting them. So, yeah. You also talk about the recommendations for boosters in young, healthy kids. Can you share more about what you've discovered there by looking at the data?
I'd love to see the data on boosters for young, healthy people, but we don't have it. We have poor observational studies that are flawed with confounding. And basically, what happened was um, the pharma companies, in their very cozy relationship with the FDA, got together and they decided they were going to bypass the normal regulatory process for the booster shots. And they made that argument for a number of reasons, and they were all on board. So now what they do is they program an mRNA to have the code for a protein that they expect to be dominant, and then recommend everyone take it. And my feeling was you can do a clinical trial to establish its efficacy and describe the efficacy. Maybe it's 2% effective, maybe it's 50% effective, but whatever that number is, maybe it's ineffective. I mean, we have to be open minded if we're truly scientists here. And you can measure vaccine injuries better. They were not capturing those. So when you don't measure vaccine injuries, it makes the vaccine look safer than it really is. And when you overcount COVID infections, as they did with incidental testing in hospitals, you make the virus look more dangerous than it really is. Now, it's nuanced. I'm not saying it's not dangerous in certain populations, but they didn't do those studies. And instead, they decided it's going to be our system to just pharma's going to program the mRNA, and then we're going to go out there and push it hard. And I just thought fundamentally that is not a good approach. It's unscientific. It's political at this point. I would hear announcements, and I couldn't tell if they were coming from pharma or the FDA. I'm not sure there was a difference at some point. And I predicted it would cause a tremendous amount of mistrust. That's exactly what happened. I don't think people know a lot of what went on behind the scenes. I think I know too much. For example, I don't know if people know that the top two vaccine experts at the FDA, Gruber and Krauss, who had been there for a long time, they were the director and deputy director of the Vaccine Research Center, highly respected vaccine experts. They opposed the COVID vaccine booster for young, healthy children. Pretty clear from their writings. They were pushed out because of that, pushed out of the agency in order to ream through an emergency use authorization approval. And then it was mandated on many young children, including our students at Johns Hopkins. And then they censored the doctors who raised their concerns. So, I mean, that's like the most dangerous thing a
Yeah.
government can do. Now, we got lucky. There wasn't, it didn't kill 50% of people who took it. We got lucky. But the process is like the most dangerous thing you can do. Fire your two top experts at the regulatory agency, force it on kids, and then censor doctors who express concerns of myocarditis. That was very concerning to me.
It's very concerning. And it's, again, goes back to this culture of, how can we create a culture where it's actually safe and encouraged to ask questions and to have differing opinions and be able to have a real scientific conversation to get to the best answer. And also it does make you question, like, what is the true incentive that is driving most of these decisions? Is it money, or is it truly the health of our population? And sometimes, it, as much as we, want to believe that we're trying to do what's best for the health of our population, I think money often gets in the way.
Gosh, Julie, it's such a good point. There's a point where scientific discussion converts into a belief system, and you cannot oppose the belief system. The belief system in that example is vaccines are good. And you cannot challenge that in any way. You're not allowed to have nuance. You're not allowed to ask questions. And we see a lot of recommendations in modern medicine. I go through them in the book Blind Spots, where a scientific discussion takes on a herd mentality and then a mob mentality, where all of a sudden questions are forbidden. And what happens is the medical experts will often lock arms and walk off a cliff together and cause tremendous damage. And there's a lot of these areas in health today. We talked about some of them: peanut allergies, antibiotic overuse, childbirth, hormone replacement therapy for perimenopausal women, where there's been groupthink that has done tremendous damage and still is actively doing damage with conflicting advice that is coming from the medical field and a public that's left in the dark. That people need to know there are things that are based on assumptions. We call it medical dogma. It is okay to question medical dogma. And while we don't want the public to become cynical towards us as physicians, there are dogmas where questioning the dogma is important and healthy. And that's why I wrote this book, Blind Spots.
Yeah, it's so important. And it's so important to, especially to see people like you who are in academic medicine, who are at, one of the most prestigious universities, to be asking those questions, because I think it says a lot. And I think the more people that are willing to ask those questions and have these conversations, the more we're going to hopefully drive change.
Yeah, the good news is our students and residents, like the young folks and a lot of doctors who feel burned out and disillusioned with the sort of hamster wheel of medicine, they are um, running to this new idea of talking about the root causes of chronic diseases, questioning deeply held assumptions, and taking care of the whole person, not just the one condition that they're trained to treat. So I'm excited. I'm optimistic. A lot of good stuff's happening. And I think we're seeing a bit of a movement right now.
Absolutely. Now, if you could, just knowing all the different parts of the system that contribute to some of these problems, um, what are some of the things, if you could design the system, if you could sort of rebuild it from the ground up, what are some of the things that you would do differently as far as it comes to, how we choose what research to do, our medical education, the culture of medicine? I mean, any aspect that you can see, what would you do differently?
Well, on the research front, we need big ideas. We need giant, big, new, fresh ideas. The incrementalism, the tiny incremental research studies that we are doing are not helping us. They're helping our friends in the medical profession that just want to get a poster on at a conference so they can
Right.
get it covered and expense their steak dinner the night before and see their friends. We've all done that, but we're not advancing medicine. We are not advancing medicine by doing that. We need giant, big new ideas, and that's what we need to fund. That means the people deciding what research to fund should not be the old guard who has their own theories of disease, who are then funding ideas that they think support those ideas. So we need fresh new ideas and we need new mechanisms of funding. We're seeing philanthropy kick in. Philanthropists fund a lot of my research at Johns Hopkins on the issues and the blind spots of medicine. We need to change the way we reimburse physicians. We need to address physician burnout by addressing the root causes. I think the root cause of the burnout problem in medicine is not hard work. I think we go into medicine wanting to work hard, right? But it's the loss of autonomy. And you see it with the electronic health record mess and many other things.
Yes.
So I think there's good stuff is happening. I think we need to keep pushing ahead and we need to address the root causes of so many of these issues how much time in medical school did we have on seed oils? Zero.
Zero.
Much time.
Let alone any other part of nutrition.
Yeah, any other part of nutrition, right? And it's like, don't you think it's time? Don't you think things are bad enough now where we need to talk about this?
It's like, it was so mind-blowing to me the way you would jump from learning about the biochemistry of, adipose tissue to bariatric surgery and medications. And it was like, well, where's the middle part about this? Where's the nutrition? Where's the exercise? Where's this, all the other lifestyle things?
Yeah. In my field of gastrointestinal diseases and GI surgery, it's that was the situation with heartburn. So here's one of the top 3 medications in the United States is heartburn medication. And how much time did we talk about the behavioral changes that can cure heartburn? Almost never. Lip service. And then just here are the 18 medications and here's the mechanisms. And, one guy I remember told me in residency, I like to do double dose, and it's like, what the heck is going on? And this became personal for me because when we do these long pancreas islet auto transplant operations, I would get heartburn from skipping meals and eating something quickly in a break. And I took medication, and then I saw one of the side effects of the medication in a new study was scary. It was like increases the risk of stroke. I went to my doc and I was like, I can't do this. I don't want to do this. Like, what should I do? What other medicine should I take? And he laughed and he said, you can do behavioral modification, changing what you eat and when you eat. And I was like, I was embarrassed. I was like, of course, I didn't even think of it. And I prescribe these heartburn medications myself, like candy sometimes, or have done in the past. And so it's a broader issue in the culture of medicine.
Absolutely. Yeah. And I think there is a certain amount of cynicism because, talking to a patient for 15 minutes every 6 months is not really very conducive to making lasting lifestyle changes. And often we want to feel like we're doing something, we're helping, and prescribing a medication is an easy way to do that.
Especially when they're demanding it.
Right.
The other thing I was going to say is addressing corruption in healthcare. This should be nonpartisan, right? It doesn't matter what somebody's political background is. Should we really be having pharma funding half the budget of the FDA? Should we be most of our medical associations are funded by industry. The American Academy of Pediatrics, one of the biggest funders, is the company that makes their baby formula and infant formula. I spoke at the big nutrition conference, the big annual conference with all the dietitians, the biggest conference of dietitians in America. And I'm trying hard not to name it because
I know which one you're talking about.
You know it. They're nice people. But afterwards, I met this woman who came up to me in the VIP reception. I gave the keynote address, and afterwards she said to me, I I took a little issue with your comments that maybe we should not be drinking 3 glasses of cow's milk a day, which is something I said in my talk is like, maybe we need to challenge some of these dogmas. Like, why are we telling everyone to drink 3 glasses of cow's milk a day? It's still the current official recommendation. And I noticed her badge said like the Milk Association on
Right.
it. And she had like these ribbons, like sponsor, premium, premier sponsor, whatever it was. And I find out they're one of the 2 biggest sponsors of the nutrition
Absolutely.
conference.
Absolutely.
And guess who the other big sponsor was?
Soda company or fast food company.
Bingo,
Yeah.
Coca-Cola.
Yeah. It's insane. That's a great point you make. I think that would just addressing the corruption would certainly help a lot.
Yeah.
When you think about, so you're doing a lot of your own research on these topics. How do you decide what is important to investigate and what's going to be, make the biggest impact? Because you've done a lot of research that has already changed practice in a lot of ways. And so how do you filter, all of the possibilities and decide what to spend your time and your resources on?
Great question. We talk to a lot of people and we try to find out what the biggest issues are that affect the health of the public. And a lot of times it's a very dynamic thing where new issues will crop up. That happened with the opioid epidemic. We were all happy humming along, doing our research, publishing our studies, and then the opioid epidemic hit and we had to pivot. The medical field took like a year to pivot. I mean, it takes almost a year to get a study published in a medical journal. And that just doesn't work when you have a health crisis. And so we pivoted to the opioid epidemic. COVID hit. We did a lot of research rapidly on COVID, hit all kinds of barriers. I mean, just the medical establishment just got all discombobulated. Like, what do you mean you want this published in the next week? And so a lot of us went to podcasts. We decided to take our message directly in op-eds. I started writing for the Wall Street Journal and the Washington Post, the New York Times a couple times. And we just realized our current healthcare system is broken. It's captured by industry. It's stuck in this dinosaur culture where we're still writing on stone tablets in medical school. We don't talk about food or food as medicine. And we need to start talking about these topics. So we talk to a lot of people. And what we keep hearing is that we need to address school lunch programs, not just putting every young overweight kid on Ozempic.
Right.
We need to talk about environmental exposures that cause cancer, not just the chemo to treat it. We need to talk about treating more diabetes with cooking classes, not just throwing insulin at everybody. We need to talk about sleep quality and exercise as it affects one's sleep, not just throwing meds at people, including antihypertensives. A lot of high blood pressure is associated with the muscle tone in the blood vessels from different sleep patterns. So we don't talk about it. These are things we need to talk about. Chronic poor sleep increases the risk of Alzheimer's, one of many things that increases the risk of Alzheimer's. We don't talk about it. That was a study that we did in our research team. We need to talk about general body inflammation. When we take in all these chemicals, you name it, seed oils that are denatured and chemicalized, pesticides, it's the body's immune system, which is embedded in the lining of the GI tract, is responding with an inflammatory reaction. And it's not a giant, rapid, acute inflammatory storm. It is a low-grade, chronic inflammation. It's constant. And when your gut is inflamed, you feel blah. You feel sick. You don't feel well. Your tummy hurts. There's a million ways to describe it. But this is what we're doing to America's children. And when they come in, we medicate them. When a child who is otherwise healthy is waking up early in the morning, we're destroying their circadian physiology. And we're doing it not because it's good for their health. We're doing it because it's convenient for adults. We put them in a classroom after a sugary, ultra processed cereal diet with cold cow's milk. And then we wonder why they're having trouble paying attention. Then we hit them hard with ultra processed refined carbohydrates for lunch. And then they have a sugar coma for hours afterwards. And then what do? We say, you can't sit sedentary at a desk for 7 hours. You have a medical diagnosis. You're diagnosed with this mental problem, and we're going to medicate you. And so we have this terrible path that we're on right now, where 20% of our nation's children are taking medication, 40% of adults. It's not, we're not, we're moving backwards. We're watching all these chronic diseases go up. We cannot leave it to the medical establishment to do their incremental, tiny little discoveries. We need a complete macro look at the big picture here. Stop what we're doing, look around at what's happening, and finally address our food supply and the root causes of so many of these problems today.
Absolutely. In the way that it's all so interconnected. And I think what you said about, taking things to podcasts or op-eds or getting the message out to the general population being so important. And I think a lot of the movement that we're seeing is coming from our patients. Just like you mentioned the Kellogg's protest, it's people coming to their doctors and saying, look, I don't want to be on antibiotics, or I want to come off of this medication. How do I do this? And they really are driving a lot of change. And I'm curious too about how we balance this, because there is so much distrust and there is a lot of things that we've gotten wrong. But sometimes that can backfire because there's so much distrust that people are not willing to, to do the interventions that actually could be really life-saving. So how do you balance that, or how do you think that we should be balancing that to get the right treatments to the right patients, and spread this message, beyond just the people who are super health conscious and listening to podcasts and doing their own learning?
Yeah, it's hard to navigate, right? Because we want people to have trust in the healthcare and medical system, but we want people to have a healthy sense of empowerment with their own health education and to ask healthy questions where that's appropriate. So here's a couple general rules, a rule of thumb that I'll put out there because it's hard to address all the nuance here. One, if you are in an emergency situation, do whatever the doctor tells you. Okay, don't question it. Do whatever the doctor tells you. If you're dealing with a chronic disease, it's good to do your own research and sometimes get a second opinion. If you're going to have an elective procedure where you may be on the border of needing it or not needing it, talk to another expert. And then when it comes to information about the root causes driving so many of our chronic diseases, there are some great sources out there. I think Dr. Peter Attia, I'm a big fan of. He was with us at Johns Hopkins. Dr. Julie Foucher, I'm a big fan of, and a good source of information. Casey Means is out there, a great book called Good Energy.
Absolutely.
I've got this book, Blind Spots. We're trying to go directly to the public. Vinay Prasad, Mark Hyman. There's a whole bunch of folks, Ken Berry. So I think there's a bunch of folks people can learn from. But those are some names of individuals and resources that I trust and I would encourage other people to learn from.
That's great advice. Well, just before we wrap up, there's 3 questions I ask everyone at the end of the podcast, but I also wanted to thank you and bring up one other topic that you talk about in the book, which is the origins of ovarian cancer, and recent research that has elucidated the root cause or the origin being more from the fallopian tube versus the ovary, and how we've maybe been approaching this wrong with removing ovaries prematurely. And I also learned that it's something that you're routinely doing now at Johns Hopkins, is offering, for people who are high risk, if they're having abdominal surgery, to actually remove the fallopian tubes to reduce their risk of ovarian cancer. And because of, preparing for this podcast and learning about this is something that you do, I was able to have a conversation with a patient today who is having an elective abdominal surgery, does not want children, has a family history of ovarian cancer. And I said, why don't you bring this up to your OBGYN? And, how important it is that we get this information out there and how difficult it is, I think, for the average, practicing community physician to stay up to date on the latest research and the latest findings, because there, like you mentioned, there isn't a lot of time to be reading all of the research while you're just trying to, stay afloat in your busy practice.
So this was a recent new discovery that ovarian cancer, that is the most common and the most dangerous types, don't come from the ovary. It comes from the fallopian tube, which is very close to the ovary. And it sounds like, well, gosh, how could doctors have gotten this wrong? Well, the cancer cells start in the ovary and then probably float onto they start in the fallopian tube and then they float onto the ovary. And so there's an opportunity with this new understanding to actually prevent the one in 50 plus chance, the odds of a woman developing ovarian cancer are between 1 in 50 and 1 in 73. And so you can massively reduce those odds by having one's fallopian tubes removed if a surgeon is in the abdomen for another reason and the woman is done having children. So there's a lot of nuance to it. I go through it in the book. But here, nothing has worked to prevent ovarian cancer. And doctors have taken out millions of healthy ovaries in the name of preventing future ovarian cancer. But it turns out we were targeting the wrong organ. And having one's ovaries intact are important because the ovaries produce estrogen and progesterone. And the estrogen has a powerful effect on health. It's a positive, beneficial, positive long-term effect. As a matter of fact, the biggest screw up of modern medicine was demonizing hormone replacement therapy
Yeah.
for women around the time of menopause. Starting hormone therapy within 10 years of the onset of menopause not only alleviates the symptoms of menopause, that is, the hot flashes, night sweats, mood swings, weight gain, and 50 plus other symptoms, which can be subtle, but it also has long-term health benefits, reducing the risk of fatal heart attacks by up to a half. That is a 50% reduction in heart disease. That's the number one cause of death in women. Reduces cognitive decline by 50 to 60%, reduces the risk of Alzheimer's by 35% in one study. I go through all these studies in the book Blind Spots. The bones are stronger in women who take hormone replacement therapy. So they're less likely to have a hip fracture or break a bone later in life. These long-term health benefits are incredible. I mean, there may be no medication that has improved the health of a population more
Right.
than hormone replacement therapy. But sadly and tragically, 22 years ago, a doctor from the NIH declared that hormone therapy causes breast cancer. I interviewed him from the book and point out how his own data never showed the claim that he stated. It never supported the claim. And it really was misinformation, if you will. It was dogma. And tragically, to this day, 80% of primary care doctors will hesitate or avoid prescribing it or never offer hormone replacement therapy for perimenopausal women because if you ask them why, they will tell you because it increases the risk of breast cancer. And if you ask them what's the evidence, they will point to that 2002 study published in JAMA, where when you dig deep into it, there's no statistically significant increased risk of breast cancer mortality.
That's
So
wild.
people need to know the truth on this. Women need to know the truth. If you know of someone who may benefit, they need to know the truth. And so that's chapter 2 of the book Blind Spots. I hope already I'm getting a lot of positive feedback from OB doctors who say, hey, we have been prescribing hormone therapy for a long time, and we were always concerned about that misinformation put
Yes.
out by that announcement. So thank you for telling the story. Of course, I do it through a bit of investigative journalism
Yes.
lens, interviewing how that dogma became so prominent. But I tell these backstories because if I just write a If I just tell you what to believe, then it'll be boring like a textbook. But if I tell you the incredible backstory
It's
of
so
how this dogma,
exciting. Yes.
yeah, then it's exciting.
It is. And it's so important, I think, that you do that investigative journalism and you talk to the people and find out what really happened because again, with all of the problems with research, it's if you're only reading the research studies and reporting on those, you're not necessarily getting the whole story on how those studies were influenced.
That's right. Yeah, good point.
Well, I want to conclude here with the three questions I ask everyone. So, the first one is what are the three things that you do on a regular basis that have the biggest positive impact on your health?
Well, one, I try to get to the gym, even if it's for 15 or 20 minutes every other day at minimum. And sure, we can talk about the long term benefits on physiology, but the truth is, you feel better. You feel better. It's like when I go out of my way to try to compliment other people with a smile. That is more powerful than three antidepressants on your own
It's so
mental health,
true. Yes.
right? So you feel better and you want to exercise. Think of it just in terms of a short term benefit. Um, so I try to do that. I try to be positive in how I talk to other people. And I would say that I'm trying hard to avoid ultra processed foods, pesticides, and seed oils. Now, the seed oils is the hardest one,
It's
but
everywhere. Mhm.
right, it's everywhere. But it's like I'm trying to be more aware of it now. And when we have the option of cooking, that's what we're doing.
Absolutely. What's one thing that you think would have a big impact on your health, but you have a hard time implementing it or something you're working on?
I think, gosh, I think I'm really interested in water right now. So I've switched to a water filtration system at one place I live at, and the other place, a reverse osmosis system. That was interesting, and it's hard because right, you just want to grab a cup of water,
Right.
you want to grab a plastic bottle where I'll get
Right.
microplastics. Microplastics now, in one study, were almost half of 1% of total brain weight.
So
Right,
crazy. Yes.
like as
It's wild.
Mr. Karp says, you don't need a 10-year randomized trial to know that's bad for you.
That's right.
Um, and it's funny because the reverse osmosis system allows you to, it measures the particles in the filter. And it's like 450 particles per million, I saw the other day. Well, like that's a lot, like 500 particles per million. That's when the EPA like will sometimes launch an investigation. So it's like very dangerously high, or at least concerningly high.
It is. It's wild. What does a healthy life look like to you?
I think eating things out of good soil, eating, these are almost biblical principles: clean
Yes.
meats, healthy, whole foods, avoiding the ultra processed foods, meditating. The word meditate appears more than the word prayer in the Bible. And I think it's because it's part of the same continuum. It's focusing and thinking about important things and purpose and meaning and being thankful. Um, and fasting. I mean, these are all biblical principles. Like, you'll see a study: intermittent fasting may increase survival in, Mexican hairless mice.
Right.
It's like, okay, yeah, it's also in the Bible.
Right. We've been doing this for centuries.
Right. Exactly. So, I think those are some things, I'm not sure I've got one that I'm focused on. And I admit I'm a bit of a serial obsessionist where,
You've got to experiment
there,
with all of
yeah,
it.
exactly.
Absolutely. Well, that's amazing. Well, this has been such a wonderful conversation. I'm so grateful for just you sharing your work, your wisdom, all of the effort that you're putting into getting answers, real answers and putting them out into the world for people to learn and educate themselves and change our system. Hopefully we'll look back 10 or 20 years from now and we'll be living in a much better system. So thank you for advocating. I know it's not probably not always easy and you probably get some backlash for the things that you say, but It's so important. And I know, I don't know, but I believe it's going to lead to, a continued momentum for change.
Oh, thank you, Julie. And thank you for what you're doing out there, pushing the field and educating people. I think it's very important. So it's a real honor to be with you and enjoyed our conversation today. So thank you so much.
Thank you.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.